Hi there, I'm Dr. Stephen Phelan. Welcome to Discover What's Possible. And I have a really nice treat for you today because I'm going to share with you a video for a patient's treatment where we completed a full mouth rehabilitation for a patient with significant tooth wear and bite problems. So tooth wear and bite problems. And there are a lot of people out there in the population that have these problems and they're really not sure where to turn to have this corrected and improved and fixed. So this video, I hope if you're one of these people that has a lot of tooth wear or bite problems, when you see this, you'll understand that there is hope for you and you'll be able to have excellent dental care as well. So let me share with you this patient. So this patient came in to see me a few years ago and he had a significant amount of tooth wear, especially on his front teeth, and a lot of that was due to the bite relationship that his front teeth have to one another. And his problem is he has a very deep bite, a deep overbite, and it's very tight. And so once he starts getting tooth wear, it accelerates and the teeth get thinner and thinner and thinner to the point where they start getting sensitive, but they're also very structurally compromised. And so we resolved this problem for this patient by completing a full mouth rehabilitation and opening the vertical bite position so that the teeth aren't quite as tight together and the overbite is not as deep. It's opened a little bit. So this is a technique commonly used in restorative dentistry, and I used this to my advantage to be able to change this patient's bite and improve the aesthetics of his overall tooth position and dentition. So here's his final result. And you can see the teeth look much better. It almost looks like it's not even the same person here. The one thing we didn't correct was the gum line between the front two teeth. And that would have required a little bone surgery to correct the one that's shorter. And we decided, because his lip line is so low and it doesn't show when he's speaking or smiling, not to correct that because it's a fairly invasive procedure. It's worth doing if it shows, but it wasn't showing, so we decided not to correct that. Otherwise, the whole rest of the results of the treatment are really ideal. And if you look at his smile, his smile looks tremendously better, but the gum line doesn't really show. So it was fine not to correct that one gum line discrepancy. And these are porcelain crowns. They're basically called the Zirconia Crowns or lava zirconia. And then there's a bridge there too, which you probably wouldn't even be able to see, but it is near the front teeth. So there is one bridge and the rest of the teeth are all single crowns. And we've built them higher so his bite is more open, which corrects the collapsing of his bite. His bite basically wore down and collapsed and changed and progressively became worse and worse. And here's a view that really shows you the before and after results of the bite change. If you look at the before picture, he actually has more overlap of his teeth than what we call 100%. He's really a deep overbite at the front, and his teeth have basically become destroyed at the front. I had to rebuild all of these front teeth with these crowns. Not only with the crowns though, I needed to do core or foundation restorations inside the teeth to help support the tooth structure so that we had proper shape for the new crowns. But the bottom line is there are a lot of people with different levels of severity of tooth wear and bite problems. This is a significant case, but there are patients with ranges from this significant to a little less than this. And I just want to make sure the message is out there that we can help you. You can have excellent dentistry. This isn't a problem that's irreversible if you catch it before your teeth break. And then from above, you can see how thinned out and worn the front teeth were. And so we crowned all of the teeth to be able to achieve this vertical bite change. And you can see the lower teeth. Again, the lower front teeth were extremely worn out and thin. And so that's the result for this particular patient with a full mouth rehabilitation, a change in his vertical dimension so his bite isn't as collapsed as it was, and a restoration of the tooth wear. And if you're a patient or a potential patient looking for this kind of dentistry, if you're willing to travel to Oakville, Ontario, Canada, which is right near Toronto, we're about 20 minutes from Metro Toronto Airport, you can contact our office at phelandental.com or call my office at 905-827-1619, and we'd be happy to arrange a consultation type of appointment, or maybe even a diagnostic records appointment to evaluate your dental condition and figure out treatment plan options for you so that we can take care of your dental problems. And if you're a dentist looking for more information on how to do this kind of dentistry, you could go to phelandentalseminars.com and just join our email list. So there'll be a box on the side of the website where it says join our email list or join our online community, and we'll send you some free training videos, and we'll send you some initial free training videos, and then we'll also send you almost on a monthly basis different free training opportunities with me, whether it be a webinar or a new video that I've created in my Dental Excellence series. I'm pretty prolific at creating new training material for the dentists in my online community. So that is Discover What's Possible. Once again, thank you for joining me on this short little video, and I'll talk to you soon. Take care.